Close the Gap Day is all about raising awareness about the health issues that face our people. And I guess more importantly, how we move forward to address them. You know, there's always a lot of acknowledgement of the issues for Aboriginal people, but we don't often spend enough time looking about how we're going to move forward or the good things that are happening in our community. So today is really significant in that we've got our event here today at Liverpool Hospital, and we are going to be looking at some of the great initiatives we've got to address those health gaps.
We're here today to celebrate this hospital and what it's doing for people, and I think that's important. And I think it's important that people keep reminding places like this hospital why they're here. They're here to service the people. Really important. And I know the leaders of this hospital have that focus.
Yamagaro, Waga, Vegan, Bawa. In Gamilaroi, my mother's language, this means hello, uncles, aunties, brothers and sisters. But also I'd like to acknowledge the Darug people, the traditional owners of the country, and also that the land was accessed by the Darug and Gidingara nations. And I extend that respect to both elders, past and present.
You know, this up for us today is keeping our culture alive and also sharing our knowledge with the young blokes that you see up here today as well.
A big thank to my mum. She's here in the crowd here with us. She's been there for everything in that. But just want to show how much I love her in that. And yeah, love you, mum.
For the local health district is really one of our most important priorities. The issue of life expectancy and the inequity of life expectancy of our Aboriginal community has to and must be a priority for us both now and into the future. And we will only achieve it through activities like today, which demonstrate that we need to work in partnership with our Aboriginal community and address the issues. Our programs have recognised a lot of the value and the culture of our Aboriginal community, and we've put a lot of work in over the last year. And the importance of that program is about raising awareness of, but more importantly, developing an understanding and a rich knowledge around Aboriginal culture.
I came from the dream time, from the dusty red soul plain. I am the ancient heart, the keeper of the flame.
Here on the Liverpool campus, we have 55 Aboriginal identified staff working in a diverse range of departments in radiology, in pharmacy, physiotherapy, anaesthetics, emergency, hotel services, cardiology, as well as community health and mental health. We have continued to recruit Aboriginal trainees across a variety of health roles, and our Aboriginal trainees form an important part of our Aboriginal workforce strategy. I believe that giving attention to physical, spiritual, cultural and social well-being will help our hospital provide greater culturally appropriate care to the more than 3,000 Aboriginal residents here in the Liverpool area.
these are exciting times because in New South Wales we haven't really had an Aboriginal health policy for over 10 years, and so to have a government that came in and say, well, we need a plan, it's quite a significant commitment to actually make it.
We are one, but we are many.
This campaign it's huge, it's mainstream, it's Aboriginal, it's non-Aboriginal, and it gives us all a chance to stand together on this issue. You know, no matter how many times as a non-Indigenous Australian man I have exposure to your culture and the opportunity to be part of it, it's an incredibly humbling experience, and so I feel very privileged to be here today.
I'm a teller of stories, I'm a singer of songs.
The Indigenous communities that come into primary care unit are often there because of cardiovascular disease, and that is often caused through things such as diabetes, renal complications, being the kidneys, and we also have problems with dietary issues as well as smoking and what have you.
I'm the whole wheat from the desert, I'm the black soul of the plain.
So the first things we're trying to do is we want to, I guess, train up staff in ED about a bit about Aboriginal culture, so we're going to do some training around that. We're looking for up to 8 people within the community. It could be staff members and it could be just people elders, or not necessarily elders, but Aboriginal people that might want to come on one of these tours.
We are one, but we are many.
Respecting a Difference framework, as some of you may have known, was launched by the Ministry of Health in November 2011, and it's now being rolled out across the state. As Aboriginal people here today, we all have come from various nations and tribes within this country. We all have our own various cultures, beliefs and dreamtime stories, but past events have united us and given us a common shared history. We believe, finally, this program will be a positive step forward and of benefit to each of us here. For to understand the present situation of Aboriginal and Torres Strait Islander people is to understand the past.
Our service is the Marangeen Aboriginal Chronic Care Program. Marangeen is Aboriginal for body and heart. We provide support and education in controlling diabetes, high blood pressure, cholesterol levels, blood sugar levels, weight control. We also have healthy eating patterns, spirometry, smoking cessation program and exercise program.
So the main job is for us to identify our people so that we can refer them on to appropriate avenues.